Hi everyone, I just want to talk to you today about the problem of hypothyroidism in complex chronic illness and the problems with testing thyroid hormones and the problems with the current approaches to treatment. So, as many of you guys know, when you're battling a complex chronic illness, your hormones go awry. You suffer from adrenal fatigue, adrenal hormone imbalances, and with that, thyroid hormone imbalances. Now, I talk about how to balance your hormones in my new healing course, A Top-Down Approach to Healing Spirit, Soul, and Body, and you can find that on my website at conniestrassheim.org. But I also just want to take a little bit of time to share with you today some of what I share in that course about the problems with thyroid hormone testing and treatment. So if you guys have been diagnosed with a complex chronic illness, and that could be anything from Lyme disease, mold toxicity, to other neurological conditions like Parkinson's, MS, chronic fatigue syndrome, fibromyalgia, lupus, whatever it is, chances are your hormones don't function right, or you have a lot of hormone dysfunction, because that's just common in complex chronic illness. And a lot of people today have hypothyroidism or low thyroid function as one of the imbalances or one of the hormone issues. And I just want to talk with you a little bit about that today, because I have learned a lot about thyroid hormone balancing in recent years, and mostly because my doctors hadn't been able to prescribe me the hormone treatments that I needed. And the reason that I couldn't balance my thyroid hormones, or my doctors couldn't, was because my cells were not utilizing the thyroid hormone that I was being given. And first, I just want to say that a lot of times people have trouble converting T4, which is an inactive form of thyroid hormone, to T3, which is the active form of thyroid hormone that your body uses. So if you've been prescribed T4 and you're not getting better, in fact, you might be feeling worse, it's probably because your body can't convert T4 to T3. And this is a common problem in complex chronic illness. Most of the T4 to T3 conversion happens in your liver, but a lot of people who have compromised liver function can't effectively make that conversion. And so that's one problem with thyroid hormone treatments that are out there. So products like Synthroid are basically useless for a lot of people with chronic disease. But in my case, I had something even different, which was that my cells were not utilizing T3. I was taking pure bioidentical T3. And my blood thyroid labs were normal, and so doctors didn't want to increase my T3 dosing. But then a friend of mine, Dr. Lee Cowden, who's a cardiologist, one day did muscle testing on me, and he said, you need 3 times the amount of thyroid hormone that you're taking. And I didn't really believe him, because I thought, well, my labs are normal. But here's the thing, blood thyroid hormone labs only show the amount of thyroid hormone that's circulating in your bloodstream. They don't show what your cells are actually using. And so what can happen is when you have toxins or inflammation in your cells, they won't uptake nutrients and hormones effectively. And so this is what was happening to me, is that I had a condition called thyroid hormone receptor resistance. And so what that meant was that my cells were not able to utilize the thyroid hormone that I was taking, and I had to take higher doses to compensate, to overcome that resistance. And so ideally, if you've been diagnosed with mold toxicity or another condition that causes inflammation, you may initially and for a time have to take higher doses of T3 or a T4-T3 combination to overcome that resistance. But the only way to know how much thyroid hormone that your body actually needs is to take your body temperature daily over, let's say, a period of a week or 2 weeks, and then take an average. Because if your temperature is below 98 degrees, that means that you are hypothyroid, or your cells are not getting enough thyroid hormone. The other thing you want to look at are your symptoms. Common symptoms of hypothyroidism include brain fog, fatigue, weight gain, thinning eyebrows. And thinning eyebrows are really like a hallmark symptom of hypothyroidism, because there are a lot of other conditions that can cause fatigue and brain fog, right? But thinning eyebrows and thinning hair are really hallmark symptoms of hypothyroidism. But you want to combine doing an analysis of your symptoms with taking an average of your body's temperature over, let's say, a week. And then what you want to do is have your doctor slowly increase your T4, T3 medicine or bioidentical T3 hormone until your temperature is normal. And so that's what I finally found, a doctor who would do this for me, who understood the concept of thyroid hormone receptor resistance. And, you know, there have been a handful of doctors that have done work in this area. And so Kent Holtorf, MD, is one of them. And he recognizes this phenomenon. But I'm here to tell you guys that most doctors, even functional medicine doctors, don't understand this. And most are probably fearful, honestly, to prescribe thyroid hormone on the basis of symptoms and body temperature. Because if you take too much T3 hormone, you can actually, you know, I'll be honest, like you can have a heart attack. And so, but if you increase the dose gradually and you monitor your symptoms and your body temperature, you should be able to eventually find a dosage of thyroid hormone that's going to work for you. You just have to find an experienced, open-minded functional medicine doctor. And I know Kent Holtorf is one of those, and there are some others as well. I actually fly to another state to see a doctor because I haven't found one in Colorado who is willing to dose thyroid hormone based on symptoms and body temperature, which is really the only way, accurate way to do it these days, because there is this phenomenon of cellular hormone resistance. And so it's not always that your thyroid isn't producing enough hormone, it's that your cells are not utilizing it. Now, the other issue is with cortisol. You have to have adequate and proper amounts of cortisol to utilize thyroid hormone properly, because your body utilizes cortisol to uptake thyroid hormone. And a lot of people with complex chronic illness either have an inverted cortisol pattern in which their body doesn't make enough cortisol in the morning and it makes too much at night, or they have too high or too low levels of cortisol. And both scenarios are not good. Both scenarios will hinder your body from utilizing thyroid hormone. And so you want to support your adrenal glands and get your cortisol levels to a normal level. And in my teaching series, I share more with you about how you can do that. But just know that that is also a factor in thyroid hormone utilization and uptake, are your cortisol levels. And in addition to that, you also need to have adequate amounts of iron. So in many people with complex chronic illness, their iron levels are low. And this can be due to the fact that pathogens affect iron metabolism and they can even utilize iron. And in menstruating women, sometimes their iron levels are low due to the loss of blood every month. But in any case, when you have low iron, your body won't effectively utilize thyroid hormone either. So there are certain nutrients that are really important in order for your body to be able to utilize and uptake thyroid hormone. Now, if you're taking a T4, T3 combination, these nutrients are even more important because there are certain nutrients that are involved in the T4 to T3 conversion, which is why I think if you have a complex chronic illness, you want to make sure that your body can convert T4 to T3, as if not, you want to take a bioidentical T3 preparation. And so how do you know if your body converts T4 to T3? Well, you want to do a test called reverse T3, and this is where thyroid hormone testing can be useful. And so if you are not already on thyroid hormone medications, or you're already taking a T4 medication, you want to do this reverse T3 test. And so that will tell you whether your body's actually making the conversion of T4 to T3, because if it's not, what will happen is your reverse T3 will be very high. And so reverse T3 is an inactive form of thyroid hormone that actually blocks your body's utilization of active thyroid hormone, or T3. So if your reverse T3 is high, you know that you need most likely bioidentical T3 hormone and not too much of any T4. So in addition to that, you want to do a Hashimoto's antibodies test. And Hashimoto's is an autoimmune thyroid condition that a lot of people have, and it's triggered by certain environmental factors like gluten. I think toxins and inflammation can also trigger it. And you can lower your thyroid antibodies by staying completely clear of gluten. Now, that may not resolve it for a lot of you, but quite often I've had doctors say that their patients' Hashimoto's antibodies will go down when they get off gluten completely. So gluten hides in a lot of foods. It hides in condiments. It hides in sauces. And so it's not just found in bread. And the reason gluten is so bad is because it can damage your gut. And most of our grain products in the United States, those that contain gluten, are detrimental for us because they have so much gluten that the body wasn't designed to process. And and also gluten-containing grains contain pesticides quite often. And so pesticides damage the gut. And then that can also just cause your thyroid function to worsen because of the antibodies that your thyroid will produce to these contaminants. And so those are a couple tests that can be useful, but just know that when you do a free T3 test, you can have normal levels of T3 hormone in your blood, but that's not necessarily an indication that your body, that your cells are getting enough thyroid hormone. And so you want to work with a competent functional medicine doctor who can really truly help you to evaluate that. And again, as I mentioned, you want to also treat your adrenals because adrenal fatigue can also cause your thyroid function to worsen because they work in concert with each other. And again, in my teaching series, A Top-Down Approach to Healing, I share more about how you can heal your adrenal glands. But finally, I just want to share with you something that's really interesting about the adrenal thyroid connection. And I just learned about this recently through a gentleman named Paul Robinson, who wrote a series of books on T3 and thyroid hormone dosing. And so Paul shares in his books that the pituitary gland, which signals the adrenal glands to produce hormones, is actually the gland that utilizes the most thyroid hormone. So that's really ironic because the pituitary, you have what's called your HPA axis, or the hypothalamic pituitary adrenal axis. And your hypothalamus, which is a gland in your brain, signals another gland called the pituitary gland, which signals your adrenal glands to produce hormones, okay? And so the pituitary gland, apparently, and I looked this up and it's actually true, the pituitary gland utilizes more thyroid hormone than any other gland in the body. And so what that means is that if the pituitary doesn't get enough thyroid hormone, it doesn't send the proper signals to the adrenal glands to produce cortisol and other hormones that your body needs for life. And so he hypothesizes that the real reason for thyroid hormone dysfunction is because the body isn't getting enough thyroid hormone early in the day when the pituitary typically signals the adrenal glands to produce cortisol and other hormones. And so I did this experiment. And so now for many years, my morning cortisol has been low. But one day I set my alarm to get up at 6 a.m., which is early for me, and I took a dose of thyroid hormone at 6 a.m. And then I took a saliva cortisol sample at 8 a.m. And for the first time in 20 years, my saliva cortisol was normal. In fact, it was high normal. And so this to me seemed to prove the veracity or the truthfulness of Paul's hypothesis, which is that when you give your pituitary thyroid hormone, then it signals your adrenals to produce enough cortisol. And that's exactly what happened to me. And so that was really revelatory. And so he would tell you that in complex chronic illness, adrenal fatigue isn't the real issue. The real issue is hypothalamic pituitary adrenal dysfunction. So dysfunction in the HPA axis. And that can be corrected by taking bioidentical T3 hormone. So that's just some food for thought. And I'm not a medical doctor, so again, don't take anything I'm sharing with you as medical advice. Just take it as food for thought. Pray to God, talk to your doctor, and just hopefully what I've shared with you today will help you to make some decisions about what your body needs in terms of thyroid hormone dosing. So thanks so much, guys, and I'll talk to you again soon.